Good evening. Welcome to today's talk. Today's conversation is about smoking, which is, I think, extremely important, especially in the times of COVID. Let's give us a minute for Dr. Sindhoora to join in. Hi, good evening. You can definitely leave it in the chat box. We'll answer through the...
Hi, Dr. Karen.
Hi, Dr. Sindhoora. Good evening.
I guess I'm audible.
You are. Am I?
Yeah, you are.
Nice meeting you. This is the first time I'm meeting you, right?
Yeah, I know. This COVID has actually virtually brought people together.
Yeah, true.
I guess I'm
Virtual
clear
is
and
the way
audible,
to say.
right?
You are.
Yeah.
Right.
So how are you doing?
Dr. Sindhoora, I'm doing good, thank you. I want you to
And
introduce
thank you
yourself.
for can you just give me a second?
Yeah, sure. Yes. I think it's better. Yeah.
Yeah, fine. Well, guys, everybody, hi, hello, everyone. I'm Dr. Sindhoora. I finished my MD Pulmonary Medicine and I've been practicing as a consultant pulmonologist since 5 to 6 years. I especially have an interest towards sleep medicine, interstitial lung disease, and I'm doing a research on a lung function test, which is basically a diffusing capacity of the lungs for carbon monoxide. So currently doing a fellowship in diabetology also. So let's see what holds in the future.
Wow, that's a lot. That's a lot to keep up.
Thank you.
Yes. So you're based out of Hyderabad, right? For people who don't know.
Yeah, I'm based in Hyderabad.
Right. Okay. So today's topic is obviously very related to you and also me. So I thought.
Yes, very good opportunity to actually create awareness to the public about this.
Yeah, true. Because a lot of people know about alcohol and what it does because it's so evident. Like when someone drinks alcohol, the effects of it is so evident that
True.
people can't like cover it or mask it. But smoking is something that a lot of people do, and a lot of people don't know that they're smoking.
Yes, in spite of knowing that it is hazardous, people still smoke. Yeah.
True. So there's obviously a great link between stress, anxiety, and nicotine use.
Yes.
I only see two kinds of people. First one are the ones who are stressed and smoking to probably relax. Other ones are the ones who smoke because they think it's extremely cool. Because
True.
Thanks to
media. The media and the friends and everything, they play a major role in getting into this addiction.
Yeah, true. So the first question, I have a set of questions for you. I think they're relevant for
Go ahead, please.
Yeah. First one is, what is nicotine? What is tobacco?
Coming to that point, tobacco is actually a plant alkaloid. Itself is the leaves which are produced from a plant, which it's a Nicotinum tabacum. These leaves can be used either in a chewable form or a dry form, a wet form, either in hookah or shisha, nargil, etc. So they are either used as the pipes, liquid form, etc. Nicotine is a chemical which is present in these tobacco. Nicotine is a stimulant which is a potent parasympathetic drug which actually binds to your acetylcholine receptors in your brain, and it hardly takes about 8 seconds for the nicotine to go and bind to your brain. It's a messenger. In fact, it's a messenger which brings messages from the brain to your body. So nicotine is a substance in a tobacco where tobacco contains about 7,000 chemical carcinogens, out of which one is nicotine. Once this nicotine goes and binds to your brain, it might be releasing something called as dopamine. Dopamine is nothing but when you feel like doing a good activity, when you indulge in meeting your good friends, eating good food, etc., this dopamine is released. Similar to that, nicotine also releases dopamine, which gives you a pleasurable effect. But the amount of pleasurable effect time would be very little, maybe for about few minutes. So the person feels like an urge to lit up another cigarette and to sustain the pleasurable effect. So that's how it creates a positive reward pathway. That's nicotine, and that's the difference between tobacco and nicotine.
Right. So people who want to know more about the reward and addiction pathway, I done a talk, I think 2 weeks back, about understanding addiction with Dr. Rahul. You can go and check that out. So you'll understand more.
Okay.
Yeah. Obviously, we'll start with lung. We know that smoking affects every organ of our body, starting from the most superficial organ, that is our skin, to the most deepest organ, including the master of all, that is. We'll start with lungs because I think that's very relevant for you. So what does smoking do to lungs?
Oh, well, once you smoke, first thing is that smoke not only just travels down your lungs, but even goes up. As you all know, it's just a vapor. So as you rightly said, it causes effects in many organs, each and every organ. So first, let me focus upon the lungs. Once you smoke, what happens? You have few cells in your lungs which are called the mucus secreting cells. These cells increase in size. They swell up, they increase in size, and they produce more mucus. Your lung has a particular capacity to eliminate this mucus to some level. But what happens once excess mucus gets clogged up? It acts as a source for infection. And lung has some structures called as brush-like structures called as cilia. So these cilia have a movement which try to push away all the dust particles or the excess mucus out of your lungs. But once you smoke, one puff of a cigarette will slow down your movement of cilia for approximately 1 hour. So that's actually for a very big time. The work of the cilia reduces, and what happens? They're unable to excrete or eliminate the mucus clogged up in your lungs, and this acts as a source of infection. And they cause a particular inflammation in your lungs where they hinder the mechanism which protects you, which gives you an innate immunity for your lungs. They hinder those mechanisms and thereby does not protect you from any infections or viral infections, especially this COVID, etc. So this is a mechanism how it affects your lungs. And as you all know, the many respiratory diseases which are associated with smoking, like chronic obstructive pulmonary disease, asthma, bronchiectasis, tuberculosis is one of the most common cause, interstitial lung disease. So a wide variety of respiratory infections and diseases have been associated with smokers. And the worst part is that smoking not only affects the individual, but it also affects the environment and the people who are close to you. Like you all might be knowing about the passive smoking. That is the secondhand smoke. The secondhand smoke actually involves two streams, mainstream and side stream. So mainstream is the one which is exhaled by a smoker, and the side stream is the one, once you lit up a cigarette, the ending of the cigarette actually eliminates some smoke. That is also a side stream of smoke which is responsible for environmental pollution, as well as they eliminate a lot of carcinogens where the non-smokers are also affected. That's why when the patients come, we always ask them whether their spouses have been smoking, or do they have anybody in the family who are smoking, etc. And there has been a lot of association, a lot of biological plausibility which has been going between the non-smokers and the lung cancers in non-smokers. But recently they found in a study saying that a substance called N-nitroso compounds have been found in the urine of non-smokers. So this also shows an association that smoking not only just affects you, your lungs, but also the people surrounding you.
Right. In psychiatry, we talk about something called as codependence. Codependence is when, people from the same family, be it siblings or spouse, they both get addicted to the same drug or different drug at the same time. In fact, I was seeing one patient today in the casualty who came with stroke, and I told him, I think it's high time you need to stop smoking. He told me, like, everybody in my family smokes. Even if I don't smoke, I'm passively smoking. So might as well actively smoke and enjoy.
Right.
Yeah. Yeah, so that makes sense.
Though people know that smoking is hazardous, but I would always stress upon saying that all the effects of the smoking are preventable. So you should not never wait for a time to quit smoking. Whether all kind of tobacco products, not only just be smoking or anything, it's always the best time to stop tobacco products so that you can protect your lungs, your health, and the surroundings.
True, true. We all know smoking causes cancer. Anybody who watched a movie in the
True.
beginning, there are advertisements, and that turned into a big joke. Actually, the Mukesh.
I know about the bangles and all.
Oh yeah, yeah. So how exactly the smoking causes cancer?
Coming to the mechanism part, how exactly smoking causes cancer, you have few cells in your body which are called as tumor suppressor genes. So anything abnormal happening in your body, these tumor suppressor genes gets activated and they suppress. There are few genes called as P53 genes. Smoking directly affects those P53 genes and few other genes called KRAS genes and P15 genes. All these genes get mutated. They are otherwise called as instruction manuals. Like they are the manuals which help your cell to grow and develop. But once this instruction manual is mutated or abrupted, what happens? Your cells start growing abnormally and the development is hindered, thereby leading to what you call as cancers, carcinogens. All the tumor suppressor genes are hindered and you have a disruption between the metabolism and the detoxification taking place in your body. And lung cancer is one of the most tobacco smoking is one of the most common causes of lung cancer. When you see the statistics, in women it is breast, in men, coming to that, first is oral, second would be lung cancer. So this is the technical part and the mechanism part, how smoking affects your lungs, causing cancers.
True. Again, just a small disclaimer. Every time I watch a movie, some of the theaters have a smoking area as well, right? Some of the multiplexes have smoking area. I hear people walking there and smoking and coming out and telling that, you watch the ad. Did you see how the oral cancer looked like? What if we get it?
True.
The other kid was telling, oh no, that doesn't happen. That only happens like very rarely. So they're just trying to scare us so we don't smoke.
Definitely not. Oral cancer is one of the most common causes in men we're seeing. Once you smoke, it's not just your lungs. Starting from your teeth get stained up, your gums get swollen. Maybe we could discuss that in the adverse effects of smoking in the other organs. But definitely tobacco is hazardous to our health.
Yeah, it is. I mean, everyone knows that it is hazardous, but we are here today to educate how it is hazardous. So you need to understand a little bit about your own body, how it responds to the external environment.
True.
Yeah.
And many people have this intention that maybe smoking one cigarette would be okay to them rather than smoking about 10 cigarettes or 10 pack years or something like that. But no matter how many amounts, it's not proportionate to the amount of smoke you do. It's always disproportionate, whether it is 1, 2, 3 or 10. No matter what, tobacco has the similar effect on your body, only is that your lung function or your lung capacity gets deteriorated at a faster pace. Normally, an individual, as we age on, every year our lung capacity reduces by about 10%. But if you smoke, your lung capacity reduces by about 30% every year. So on an average, he loses about like 10 years of quality of life.
Yeah. Also, people think like, oh, but nothing happened to my friend. He's been smoking for the last 20 years. It can happen on the first year.
True. And smoking is like that, which can't give you the effects immediately. Your each and every organ gets deteriorated, affected with the smoke or the tobacco products, and each and every one comes out on a particular time.
True. Also, multiple factors play a role, like genetics play a role, and independent
definitely
plays a role. So all this definitely plays a big role, and your lifestyle generally plays a role.
Definitely.
Yeah. What about COVID and smoking? What's the relation?
Well, COVID and smoking, as you all know, it's always a risk factor for many things, not only just COVID. But once this pandemic is running now, I would like to stress upon COVID is like an infection which uses your acetylcholine receptors, ACE2 enzymes, for your cellular metabolism. In these smokers or chronic obstructive pulmonary disease patients, what happens is ACE2 receptors are on a higher expression. So these smokers are on a more vulnerable for COVID. And COVID, as you all know, is a droplet. I mean, it spreads by droplet infection by touching each other. And smoke, you use your cigarettes, your fingers to your mouth. And there is always chances that the transmission is more when you use a hand-to-mouth contact. And as you all know, hookah, this has been sharing in the places and everywhere. So there is a transmission of the share and everything. So that also increases the risk for COVID.
Right. Even cigarettes, people share cigarettes,
Share the cigarettes, true. So basically, it's the saliva and the droplets, the sneezing and everything. The COVID is a major factor for that. So not only just COVID, tuberculosis is also one of the most common thing which gets transmitted via this pathway.
Also, I think most of the patients that we are seeing are succumbing to the infection. The complications of COVID are mostly smokers.
True.
And the ones that are
always a very big risk factor, which is preventable, but people need to understand that.
Yeah. Even the ones who smoked and are abstinent for the last 2-3 years, the many years of smoking would have already caused the damage. So in ICU, every time I see a patient or I ask them about smoking history, they say, yeah, I'm a smoker. Or the family member says that he or she is a smoker.
Definitely. History plays a role in our the patients we see daily.
Yeah, correct. What about smoking's effect on other organs?
Well, smoking on other organs, once we can start up with the mouth. You smoke, your teeth get stained up, your gums are swollen, you have chances of oral cancer. As I told you, smoke not just goes down, it even goes up. So you have chances of nasopharyngeal, everything cancers. Throat, your voice gets changed, inflammation of your throats. Then as I've explained about the lungs and the cardiovascular system, which is the most important system in your body. Smoking causes atherosclerosis or thickening of your blood vessels. So the amount of oxygen which is delivered to the critical parts of your body gets reduced. When you smoke, you have what is called as carbon monoxide. This competes with your oxygen to the hemoglobin. Normally, oxygen binds to hemoglobin. So this carbon monoxide competes with oxygen and it binds to hemoglobin, what is called as carboxyhemoglobin. And this reduces the amount of oxygen which is required to the other parts of the body. That's the reason, oxygen is the one which gives you energy. This is the one which produces ATP. That's the reason smokers feel lethargic. They are feeling weak. They don't have the strength to do the daily activities as they keep on increasing the age. And cardiovascular system, they're prone to atherosclerosis and they have double the chances of myocardial infarction, strokes, etc. And the other thing is that, as I told you, they reduce the blood supply even to the limbs, the peripheral limbs, causing what you call as peripheral vascular disease. Even though you repair that, it takes time for a lot of time to heal it. That's why all the vascular surgeons have been asking whether they smoke. And they ask you to quit smoking because smoking delays your healing. It has a delayed wound healing. And coming to the other thing, it even has an insulin resistance, which has a more chances of what you call as type 2 diabetes development. Your eyes get affected. There are more chances of getting cataract. And coming to women who are pregnant, they have chances of miscarriage. There are chances of what is called as ectopic pregnancy, where the embryo gets planted outside the uterus. There are chances of membrane rupture. Placenta gets early separated. For the babies, you have cleft lip, cleft palate, stillbirth, miscarriages, low birth weight babies. And even conditions like sudden infant death syndrome has been observed in patients, babies where the mothers were smoking. And in men, they even affect the reproductive system, like the sperm count reduces, they have erectile dysfunction and leading to impotency. Bones, this causes osteoporosis on your bones. Like I've been telling you, each and every organ is being affected by smoke. You have myeloid leukemias, the list goes on.
Yeah. Even for people who want to look good,
early aging, yeah, true. Skin gets gray, dull. It has early aging. Your hair gets grayed up.
Yeah.
Premature aging of your gray hair.
Yeah. Even most of the patients that come to us with eating disorders, they are the ones who try smoking as one of the mechanism to lose weight.
Loss of appetite.
Yeah, because of loss of appetite, they some people eat and they purge, or some people use laxatives, some people eat and smoke. That turns into nicotine dependence. That makes the prognosis of the disease even more complicated while treating the patients. Yeah, that
True.
is one thing. Yeah, yeah. So I think I would like to talk about effect of this on the brain.
Yes.
I mean, you briefly mentioned about strokes. I mean, we all know that there are 6 risk factors for stroke. One is non-modifiable. Rest all 5 are modifiable. The non-modifiable risk factor is your gender. Men are definitely at more high risk for developing strokes than women. You can't do anything about that. Whereas rest of the 5 factors, one of the top one is definitely smoking. There is alcohol, there is diabetes, hypertension, and your cholesterol dyslipidemia, where your cholesterol levels are altered.
The HDL levels, yes.
Yeah. Whereas diabetes, hypertension, and dyslipidemia, we doctors can treat. What about smoking and alcohol? That we can treat, but then you have to even come and see a
The
doctor for that.
individual play a very important role in that.
Yeah, it plays a very important role. And strokes, recurrence of the strokes is decided by if you're a smoker or not. That's one of the definite factor that decides it. And another one area where we see a lot of smokers coming with problem is dementia and cognitive decline. We all know that our body shrinks as we age. All the organs shrink as we age, especially brain. Irreversibly it shrinks. The volume of the brain becomes small, so the memory, attention, concentration, orientation, your logical thinking, abstract thinking, all the higher mental functions that make us human, not lower animals, is from your brain. When the brain volume shrinks, you obviously won't be able to remember anything. You keep forgetting things. That's called as dementia.
True.
And many more things happen, but one of the main thing is definitely memory disturbances.
And smoking being morely addictive in patients of adolescent age group, as you said, it affects your brain development and cognitive function. I would like to mention they have this acetaldehyde enzymes in the teens. That's the reason why smokers in the adolescent age group are more prone for addiction rather than other age groups.
Oh yeah, definitely. And also we have observed there's a big research, and it's almost for the last decade it's going on, where women who are smokers, especially when they're pregnant, they give birth to children who can come with ADHD, which is called attention deficit hyperactivity disorder, which is extremely common. It's 10% common in boys and 5% common in girls. So that is another big revelation and risk factor for when it comes to smoking. Also, most of the patients who comes to a brain clinic, they use smoking as a coping mechanism for anxiety. Fairly so, because they definitely feel relaxed once they smoke, because of
that's the pleasurable effect produced by nicotine.
Effect. Yeah, but understand, smoking is a risk factor for anxiety disorder. It pushes your normal anxiety into pathological anxiety and a disease. So you should obviously try alternate coping mechanism or see a doctor, therapist, etc., rather than smoking. That is definitely a very important thing. Yes, I think pretty much that's about what it does on brain, and it has incidents with schizophrenia, psychotic disorders, multiple areas, but we can't get into.
Yes, as you said, nicotine is a very dangerous as well as potent chemical, and interestingly, nicotine is found in some of your plant-based foods also that we eat, like potatoes, tomatoes, and eggplants. The amount of dose is very little, like 0.0001%, which does not cause much effect on your brain.
Right. One of the last questions for you is, a lot of people, even some of the people that I know from USA, when I ask them, why are you smoking? You need to stop smoking. They're like, oh, I'm not smoking, I'm vaping.
True.
So can you
I have seen a lot of patients and other people around me also doing that. Well, many people think that switching on to e-cigarettes or vaping is something different, and they're trying to break this addiction of tobacco, etc. And vaping and e-cigarettes term has been always interchangeably used. I don't know, maybe because of the media effect or what, I don't know, but they're interchangeable. But frankly speaking, e-cigarettes are something like which are just like your traditional cigarettes. They similar to that of traditional cigarettes, but they're battery operated ones. They have what you call as a power button, which is on and off, and then they don't have actually a refill tank. So it's either a rechargeable one or a disposable one. That are e-cigarettes. And vaping is actually a process of inhaling and exhaling smoke, which is released from a vaporizer where you use a liquid. And these are either in the form of vape pens or e-cigars or cigarette pens or something like that. And these liquids have something called as flavors, which increase your taste either in the mint form, chocolate form, etc. So these vaporizers, they are battery operated ones which contain an electric coil and an aluminium coil. This gets heated up, and just like your steam, when you heat up the liquid, this liquid which is in the vaporizer gets heated up and they produce a smoke. But e-cigarettes, vaping, or whatever procedure it is, all these release about similar amount of carcinogens which are being released by tobacco smoking. So there is, but comparatively, the second-hand smoke because of this e-cigarettes or vaping is less because they don't eliminate the mainstream or the midstream smoke.
Right, right. What about hookah? I mean, hookah is widely popular. People think there is no tobacco, there is no nicotine, it's just smoke.
Well, hookah is also a similar kind of thing, and hookah is more dangerous because to take a breath from your hookah, you need a deeper breath. I mean, more lung capacity to take through that hose pipe. And it's a similar product of tobacco which is present, which gets heated up in a bowl or a charcoal and then gets cooled up and then passes through your pipe. And interestingly, hookah, 45 minutes to 1 hour of hookah is what you spend time in the hookah bars or something like that. And that would be equal to about 200 puffs of your cigarettes. And 20 puffs of cigarettes approximately release about 500 to 600 ml of smoke. And whereas this 1 hour or 45 minutes of hookah will release about 90,000 ml of smoke. So hookah is the amount of the smoke you're inhaling is also more. Though people think that maybe it's, as you rightly said, they don't contain tobacco products, but the flavoring agents or all these flavoring agents contain a particular compound called as polyaminoglycans, which are very highly carcinogenic. They contain cannabinol, tetrahydrocannabinol, and etc. All these found to be carcinogenic. So hookah is also one of the other form, but it's equally dangerous as smoking. So I would always suggest that not just smoking or vaping or hookah, all the tobacco products have to be stopped for a better health.
Yeah, for sure, for sure. Also, people who want to quit smoking, please consult a doctor because some of you might develop withdrawal symptoms. That's one of the reasons why people keep going back to doing drugs, not just for the pleasure. So we have nicotine patches and we have lozenges and gums, and there are certain medications because some people with comorbid depression, anxiety also use smoking as a like a
true, as an alternative for coping up all these things.
Yeah. So we can treat you with for the main illness. So naturally you will not want to cope with something like this. So please see a doctor. That's for sure.
And the other interesting thing, actually, many people ask me when you're talking about this nicotine replacement therapy, we use nicotine in these lozenges or the patches or inhalers and everything. As we all have been talking that nicotine is an addictive, it's a chemical compound, it affects your brain. Then how do you use this nicotine, your nicotine replacement therapies? That's what I get a doubt as. Well, nicotine, when you use all alone, it does not have an addictive property. In the tobacco, it has a particular thing called as monoamine oxidase enzymes or inhibitors. These, when combined with nicotine, have an addictive property. So don't be of a misconception that nicotine is safe enough because we're using in the replacement things or in the gums, so I can take nicotine in some form or the other. But once it vaporizes, if you see nicotine as such in a pure form, it is oily and colorless. But once it vaporizes, it releases the smoke, which is highly carcinogenic.
Yeah. Also, I think one very important thing I forgot to tell, effect of smoking is on sleep.
True, the sleep is quite disturbed.
Yes, smoking can mess your sleep to another level that sometimes becomes difficult to repair it as well. It basically, I keep telling all the patients, do not use any stimulants after 6 p.m. Coffee, caffeine, or carbon, any sodas, etc. Smoking, especially after 6 p.m., affects your sleep. I'm not advising you to smoke before 6 p.m., but I'm telling you,
true.
you know, because, I was doing this IT talk and I told people absolutely no smoking after 6 p.m. So people are like, so is it okay if we smoke before 6 p.m.? No, that's not what I meant. What I said was somebody who is smoking close to bedtime, smoking increases sleep latency. That is, time taken to fall asleep is definitely increased. And also there is something called slow wave sleep and also delta sleep. That is the deepest stage of your sleep. That also gets impaired. So you might be sleeping for 10 hours, but you're never going to sleep, reaching the deepest stage of the sleep. So you never wake up feeling fresh. You're always feeling cranky.
True. Your
Again,
morning headache and everything.
it's a cycle. And also it causes sleep fragmentation, where you'll have broken sleep. You'll wake up multiple times. Or, you'll have dreams, nightmares. You can have restless leg syndrome. All this can occur. I think I'm only talking about 25% of the things that can happen to you with smoking. You agree?
True.
Yeah. There are more things that can happen, but these are definitely the common things that we mentioned today, right?
Yeah, just on a brief note to everybody, all the audience can understand like what exactly smoking does to your body, each and every organ, and how you can help yourself from preventing it or something like that. If you go into the depth of smoking and the mechanism, how it affects each and every cell, I think it's really vast enough.
It is.
And as you said, the more time you give for the patients who don't smoke, even the cilia motion have been found to be improved. The more time you don't smoke, for example, patient sleeps and wakes up in the morning. That's the time where he doesn't smoke. And immediately when he wakes up with a peculiar kind of cough. That's because he tries to bring out all the mucus that has been built up, and the cilia get back to their work and they try to push it out. And that is what you call specifically a smoker's cough.
Yeah. Yeah. Also, I have a question, right? A lot of people, like even my cousins and other people, when I tell them, like, why smoking? They say that, without smoking, I won't have my bowel movement. Like, I can't use my washroom in the morning. What is that about?
People are of the consumption it affects your gastric motility. Smoking, once you smoke, they affect the epithelial cells which are present in your stomach, and they affect the gastric motility. That's the reason why they have an urge to use your washroom, or that's when the bowel movement gets developed. And that's how they've been acclimatized or used to yourself. Not only just smoking, if you think about coffee or tea, many people even say that once you don't have a cup of coffee, they're unable to use the washroom or attend the morning calls or something like that. So that's how your body responds to a particular addictive substance, whether it be caffeine or tobacco or anything like that.
Yeah, true. I think we covered pretty much everything. Is there anything that we are missing out that is very relevant?
In brief, smoking is that. Maybe we can talk a little bit about how you can help patients with the rehabilitation or the peer pressure. As you all know, this year's theme in the May 2020 was basically focusing about the youth, industrial manipulation of youth, and how to protect them from tobacco and nicotine use. So how the media or something helps or has an influence on a patient's use for tobacco.
I think government should have stricter policies about how smoking is shown and what light it is shown. Just writing smoking is injurious to health below somewhere with like such a small font on a 70 screen is definitely not going to help. Because if there are kids, people in the vulnerable age group, if they're watching it, when they're glamorizing smoking, even the smoke shots are very cool. They're done very aesthetically.
That's how the media portrays it.
Portrays it, right? They don't understand the biggest influence, especially India has, is definitely from movies. We only learn from movies. Everything, how we behave, how we romance, how we, how we cope up. Everything is learned from the movies. It's an observed behavior. So government should have definitely a policy of not showing smoking in a good light or in a very cool way. So that is one of the first things. And another thing is, having campaigns in school. These are preventive strategies, right?
True.
In the school,
Educating, bringing awareness about it.
Yeah. Yeah, where you're not just saying that smoking causes cancer. Everybody knows this line. Everybody knows this line. But how common is cancer? People think cancer is a very rare entity. It doesn't occur to all of us.
No. Yeah. Understand.
Yeah, so they should follow up the statistics because the statistics are definitely rising, right? So they should bring in experts like you and me or different, other doctors to talk, have education in the school about. You can have like clay models, or we can show them pictures of how a smoker's
You can
lung
use the
looks like.
social media also plays a very important role nowadays. You can make some
Yeah,
support groups
yeah,
in helping making a plan to quit smoking,
yes,
give them the psychological support,
yeah,
something
yeah.
like that. Yeah. And
Also, I think,
out of it, globally, India is the second largest tobacco consumer as well as a producer.
yeah, yeah, yeah. Also, I think, I mean, it all goes back to your adolescence, is what I feel, right? In adolescence, people should be taught life skills or coping skills, because if
True.
how many of us
That's
have
the age when their cognition
yeah,
develops.
yeah. I mean, how many of us learned life skills or coping skills in school? I only had like
True.
social, mathematics, science, and my language, right? I mean, so I never knew if I'm going through a stress, how do I cope up? I wouldn't know. Not all of us would want to go and see a doctor. At least, I mean,
True.
we're not there
I mean,
yet.
it's also
So,
a
there
stigma
should be,
seeing a psychiatrist or a psychologist going and seeing because of your
yeah,
mental health, but it's
yeah,
definitely a part of your normal routine checkup where you need to visit a psychiatrist
yeah,
for your mental health.
yeah. I mean, times are changing, but then still there are many places that are not, that are out of reach for seeing psychiatrists. But
True.
even before that, they can just bring in like some small counselors, like counseling support group in the school, which is active and functional, not just for the namesake. Every school has
Definitely.
these days like a support group. Yeah, but if I'm going through something, I won't be comfortable going to the counselor within my school because of my confidentiality. I won't be able to trust her or him in not
Yeah,
letting
I
my
understand.
details outside, right?
So
Also,
that's
if
how
you're a
education
smoker,
plays
just
a very
understand your kids
important
will have
role
a,
for.
yeah, yeah, yeah. Also, if I'm a parent and I'm smoking in the house, and if my child is learning that from me, because we all learn and observe and imitate, right? We all mimic our adults. So I think you have to be very careful of what without your knowledge you're passing down some of the bad habits to your kids as well. So
To your
that you have to be
children.
very careful about. Yeah, yeah. The other day, uh, um, uh, this girl was smoking, and I told her I think it's not safe. Maybe you should just try to quit. She told me, when men can smoke, why can't I smoke?
I understand.
I
Yeah.
said, I said that's not the way you look at feminism or gender equality.
The thing of gender equality.
That's completely a false understanding of what gender
Mm.
equality. Anyways, even for the patients who come to us, we set a
And
criteria. We don't
actually, women have more side effects when they smoke comparatively to men. They experience menopause a little earlier than the other women who don't smoke, and their
yeah,
fertility comes down, and their health hormones are in quite an imbalance for because of the smoking.
yeah, yeah.
So
Even
that's not how your body has been designed. So you
yeah,
need to stop smoking.
yeah. I see a lot of IT patients, right? Most of them, their coping mechanism is only smoking. They all gather every 1 hour or 1.5 hour. They have a smoking area where they all take a puff and they feel relaxed. Um,
Rather of indulging in these kind of activities, maybe they should indulge in some other activities where they feel good about, not just
yeah,
smoking, because as we have all discussed, it's not just the sustainable living also.
yeah, yeah. True, true. I mean, uh, everybody is involved in taking care of themselves and people around us.
Definitely the environment, we might be giving, this is what we need to give our progeny, so our environment is also very badly affected because of the tobacco smokes.
Yeah,
It contains carbon monoxide, tars, arsenic. Coming to the chemicals, a lot of chemicals in it, nickel, chromium and all. So
yeah,
all these chemicals, 7,000 chemicals, can you just imagine?
yeah, yeah. I mean, if government is thinking hiking the price of a cigarette packet is going to stop people
Even
from
the
smoking.
e-cigarettes, though they're banned in India, many people are procuring the e-cigarettes from their friends, from US or whatever.
Oh yeah,
Everybody is using e-cigarettes and vaping in some or the other form.
oh
They're
yeah.
getting flavoring agents, the refill tanks and everything.
I mean,
So
if I
no
go
point
out,
getting banned it in India. Even they need to ban the export and import.
yeah, yeah. I mean, even if I go to a lounge or a club on a Saturday evening, all I see is everybody is vaping. I was wondering how are these people getting this e-cigarettes access? How are they even buying? Everybody says it's from abroad. Like I got from abroad, or
True.
my friend got from abroad.
But that's not how things have to be, right?
Yeah. True, true. Also, I think one more important thing is people with intellectual disability and mental retardation, people who are born to smokers. Don't think smoker is only, I'm talking about smoker mother, smoker father also, because both together together is making a baby. So it's not just one person. Maternal and paternal things, maybe not equally, but definitely play a huge role. So that's one more thing.
Role on the child,
Yeah. I think that is all of our questions. I was trying to see if anybody has any questions, but everybody's only saying hi. So hello everybody. I think we
Well,
pretty
this
much
was my
covered it.
first live question in the Insta.
I think it went well. I think we spoke in detail. I think we spoke what's necessary for people to know. Yeah, I think that brings us to end, Dr. Sindhoora. So
Yeah.
any thoughts while you end?
Um, well, first thing, I need to congratulate you for doing this midweek mental health and destigmatizing mental health. A very nice initiative so that you bring awareness to the common people and the public. And I would say that smoking in some or the other way is always dangerous. Don't try to postpone it. It's always the right time to quit smoking. Take the necessary help. Ask your family, your friends, your social groups, your supporters, your professionals, and everybody, and try to quit smoking. And a simple tip is that many smokers have always told me that once they start smoking, to combat the addiction or something like that, they try to chew a lot of cucumber or carrots so that they feel good about it. I don't know how it helps, but try doing this. Maybe it helps few people over there.
Yeah. Thank you so much. Thank you that
Thank you, Dr. Sarah.
yeah. I mean,
Yeah, it
I'm
was
glad.
nice.
I mean, you're educating
Thanks for this
making me to understand.
opportunity.
Yeah. No, my pleasure. My pleasure. I'll see you soon. You take care and
Thank you
stay
so
safe.
much. Take care.
Bye. Bye. For everyone, I hope you learned a thing or two today about smoking. Please go educate other people. That is extremely important. And I'll see all of you next Wednesday. We have another super interesting topic. Good night.